My name is Leonard Copertino. I'm a board-certified general surgeon here at St. Mary's Hospital. So I am a born and bred New Englander. I was born in Connecticut, went to college in Vermont, did some med schooling in the Caribbean and in New Jersey, and then I did my surgical training in Connecticut and on Long Island. And I've been an attending surgeon on Long Island, in central New York, and most recently here at St. Mary's. I grew up in the field of medicine. My dad's a radiologist, so I used to go spend time in his office when I was in grade school. And it was always something attractive to me. It's technically very demanding and very interesting. There's always a new challenge. No problem is ever quite the same. And it gives me a chance to both fulfill my own talents and interests while helping other people. There's few feelings greater than being able to say, I saved somebody's life today. So it's very rewarding. So I deal a lot with general surgery. I have a particular fondness for fixing hernias. We see quite a few of those. I also do a lot of gallbladder surgery, which is very common. My practice stems from things as minor as little skin bumps that need to be removed because we're concerned that they're growing or because they're annoying, to major colon surgeries, major bowel surgeries for cancer and for other issues. So it's a pretty broad spectrum of stuff that I perform. So teamwork in surgery is very important, both within the OR, just within the crew there, but also within our department, because there are some procedures which we just can't do by ourselves. So if I have a very large, complicated surgery and I need an assistant, or even just a second set of eyes, I'll call on my partners, Dr. Akasi or Dr. Tridestam, both for technical assistance and for opinions. But the same is also true in the office setting. If there's a patient whose disease process is a little unclear or unusual, if there's a question about a diagnosis or what the best way to proceed is, we'll converse in the office setting as well to determine the best way to proceed with caring for a patient who's maybe a little less normal. This brings to mind a patient. I had a gentleman who had his annual physical, was found to be somewhat anemic. Wasn't ever a problem before. During his workup, he was found to have actually an early stage colon cancer. It was my privilege to take him to the operating room, remove that tumor. He's now cancer-free. And I expect that he'll live a long and productive life and be very healthy. And it's one of those moments where the system works exactly the way it's supposed to. He had his regular care, a small problem was identified. We did a little more investigation. We found a big problem that potentially could have been life-threatening, but we caught it early. And so now the overwhelming odds are he's gonna live the rest of his life, another 40, 50 years, and he'll be perfectly fine. And we all get to feel great about ourselves because we were part of that. So, and there's many examples of that throughout healthcare, and it's really what makes the job so valuable and rewarding from a personal standpoint.